My name is Sophie Mitchell. I'm a clinical psychologist and I work in the NHS. So my job as a clinical psychologist is working in physical health settings. So I support people adjusting to physical health conditions or who might experience anxiety or depression as part of that. So I work in two different services, so one working with adults with chronic muscle and bone pain, and then I work the rest of the time in a children's hospital in a neurology service. I think what I like most is doing work with directly with patients and families, so in therapy. I think the best part of that is seeing someone achieve something that they never thought would be possible for them, or just seeing like a bit of a light bulb moment when things that felt really difficult for them have kind of come together and made sense in therapy. So I was in university for quite a long time, which is like the only way to become a clinical psychologist. So I did an undergraduate degree in psychology, and that was a 4-year course with like a sandwich placement year in the middle. I think I did that just because I liked it at A-level, and originally at the time I wanted to be a speech therapist because I'd gone through speech therapy, so I was interested in that sort of therapy generally, and then but yeah, just kind of thought I'd quite like the psychology bit. A few years after my undergrad I did my master's in psychological disorders in children and adolescents. A few years after that, then I did my doctorate in clinical psychology. So that's a kind of professional paid training programme at that kind of academic level, where you're doing lots of learning at university, but then you're also going on placements in the NHS in order to apply that learning and kind of start to work as a psychologist. I think I would advise and tell them that it's okay to not have all of your decisions made, that not everyone can decide their passion and their choices from a really young age, and actually some things, and that was my experience, that some of those things kind of take a while to develop and to be able to make those choices, because I know that that's a difficult part of it, and not just about stammering as well, but that it's okay to be guided by that, but to acknowledge that stammering does become a difficult part of that process, and that's okay to find that difficult. But I would say that passion in the end, when you are working, that's what you're thinking about on a daily basis. At least that's my experience, that becomes the more important thing when you're at work, that it's more about your skill set as opposed to how you're saying what you're saying. And I think I would advise kind of generally it's really helpful to know yourself and to know what is challenging, so to understand your own triggers and how you might need to be supported at university, you might need to be supported at work, and to be able to express that, so a good employer and a good university will be able to support you in that way and make those accommodations that are needed for you to succeed. Disbelief. I think I was very different at age 13 in terms of that was my first experience of speech therapy, and I never would have sounded like this, let alone also been able to talk about stammering. So it was something I really kept as a big secret, so I did everything I could to push it away and to not talk about it. And so now that I'm at the point where I can do something like this, that I can speak more publicly about stammering. I think that would be something that would come as a bit of a surprise. I think overall I can't say that my stammer has held me back, because I know I've achieved what I wanted to achieve for such a long time, and that I can be really proud of this whole journey and to have gotten to the point where I am. So in that sense, no, I think there are always opportunities at work and moments that I turn down. So some things at work, some projects or things like that, and tasks that I might decline, or kind of little everyday moments that I might not put myself forward for, outside of work. And some might see that as kind of holding me back, but I think I try to see that as acknowledging what the situation is and allowing myself a bit of slack, that actually it's okay, that I don't have to put myself forward for everything that I'm scared of and everything that might feel really stressful for me. I can be a bit kind to myself and know, okay, so I don't quite feel ready for that opportunity right now, but I can do this other thing instead that feels a bit more manageable. But that I'm always keeping in mind what my end goal is, and kind of knowing that I'm doing things that I can really be proud of.